You know, we all want to stay healthy, and that's why I'm here at Village Medical, and I'm with Dr. Rosen Trinidad. Thanks for being with us today.
Well, you're welcome.
All
nice
right.
meeting you.
Well, tell me about primary care.
So primary care is the initial initiation point where people can find their doctors or nurse practitioners, and also to get to know them and start to establish their medical care, where we take your vitals, we take blood work, as well as immunizations, and also treat any of their chronic illnesses.
Oh, okay. So preventative.
Correct.
Yeah. Who is Village Medical?
So Village Medical, so when I first got on board, I remember the CEO's message about trying to put small town doctors back into the big cities, where we'd actually have a community family doctor, where we know who you are, where we know who your families are. And we take care of not just your children, but your grandparents, your neighbors.
Yeah.
And just like when I was working in small towns, I knew a lot of my patients in the grocery stores and at church.
Right.
These are the folks that I want to take care of. So that's what brought me to Village Medical.
Yeah, we've kind of come away from that. So is that why the community here, why they should come and visit?
That, yes, predominantly because I do believe there's been a change in medicine where it's almost like a factory, where you come in and out with 10 minutes, 15 minutes. That's not how I do medicine. How I do medicine is I get to know who you are. And patients, well, the term patients means taking your time.
Right.
So that means patients out there should take their time, because there's sometimes people need a little bit more time.
Yeah.
And so I address the larger needs, and as a community, we're supposed to look after each other.
How do you like practicing here at Walgreens?
Walgreens, I love it. It's spacious, and we have easy access to the pharmacy next door. I know them by name. They come and we talk. We talk about other things just aside from just medicine. We know each other.
Yeah. What would you say about the design of the practice?
Oh, it's huge. So we have a huge lobby up front, and this is all sort of physician mediated. Family doctors help establish how this office should look and how it's designed. We have teleprompters, where patients can actually, they don't usually wait that long before they see me, but they can access some medical information by touchscreen. Yeah. And also, like I said, Walgreens is right next door, and I know them by name, the pharmacies, and we just talk to each other with patient care. So that's kind of neat. They could also, patients, once I prescribe the medication, they could pick it up right next door.
Okay. Well, it makes it very convenient.
Yes.
How can they find out more?
So we are online, so they could contact and schedule an appointment, or they could call one of our clinics. Okay. And so you get easy access through that way. Okay. There's also, we use EMR, which is our medical records, and you could send me a message, so we could schedule you in for any acute visits. For example, if you get sick and you don't want to go on a call line and have to wait like maybe a month to be seen, just shoot me a message and I'll squeeze you in.
Okay. Well, thank you, doctor. Thanks for being with us.
Well, it's a pleasure meeting you.